So, what is chickenpox? Contrary to its name, it's mainly a human virus and cannot be spread by animals, so you don't get them from chickens. You can only get them from another person, which leads me to wonder who got chickenpox first. Aside from endless questions, chickenpox was first recorded and described by Persian scientist Reyes and further described by Giovanni Filippo. It was first properly distinguished from smallpox, a deadly disease that has now been eradicated at the end of the 19th century. It is a highly contagious virus called the varicella-zoster virus, abbreviated as VZV. You only need a small amount of the virus to get sick, which is why it is so contagious. Luckily, this virus has no mutations or variations. The first time someone contracts this virus, it is called a primary infection, caused by the varicella-zoster virus. Numerous ways that it could spread include coughing, sneezing, direct contact with blisters, touching recently chickenpox-contaminated items, or contacting shingles blisters. When one person is exposed to chickenpox, it can be a few days until symptoms and rash starts to show. Fever, loss of appetite, tiredness, and feeling unwell are all symptoms that can appear around 2 days before the rash themselves show. The person starts to be contagious at around 48 hours before the itchy rash starts to appear. The rash has 3 stages: a raised red bump referred to as papules, blisters filled with fluid that will burst and leak called vesicles, and a last stage where the blister is broken and crusted over. Because more bumps appear over the 5 to 10 days that the rash can last, there can be multiple bumps at multiple stages at the same time. Only when all the blisters are crusted over is the person not contagious anymore. There is a chickenpox vaccine which is highly recommended. In the US, children between 12 and 15 months of age receive a first dose, and a second dose at around 4 to 5 years old as part of a vaccination schedule. There is a combination shot, varicella along with measles, mumps, and rubella, sometimes abbreviated as MMRV. In Canada, univalent or combination vaccines are recommended for routine immunizations for children over 12 months and under 13 years. Older adults or adolescents that haven't gotten the chickenpox vaccine can also get it. People that have higher susceptibility are recommended to get it as well. Those who cannot get the vaccine are pregnant women, people with weak immune systems like those with HIV or are taking certain medication, and people that are allergic to gelatin or neomycin. Before chickenpox vaccines, there were about 350,000 cases yearly in Canada. Immunization has decreased the numbers, but it is unclear by how much because of significant underreported cases of chickenpox. After the year 2000, 11 deaths has been reported in children with around 0 to 3 deaths a year. This virus is a strange one because it can never be eradicated from our bodies. After getting chickenpox, the person will not get chickenpox again, gaining immunity. It doesn't just stay latent in your body forever though. When there is much stress, weak or low immune systems, or other factors, chickenpox comes back again as, and you guessed it, shingles. After staying latent in your nerves in the spinal cord near the brain, or the cranial nerve ganglia, it travels to a dermatome. It is usually in bands across the lower abdomen or chest, but it can appear at any dermatome, even the nerves around the eyes. Varicella is part of a group of viruses known as the herpes viruses, but it is not the same virus as the herpes simplex virus, HSV. When it comes back as shingles, it is called a herpes zoster, sometimes abbreviated as HZ. You cannot catch shingles from another person, and you can't have shingles before chickenpox. If a person comes into contact with shingles blisters, it is possible they will get chickenpox if they haven't already gotten it. They will not get shingles as a result of contacting someone with shingles. Shingles appear in blisters similar to the ones in chickenpox, though only in certain bands. Pain is usually the first symptom, but it can have a burning, numb, or tingling sensation in the area. In Canada, it is estimated that there are 130,000 new cases of shingles each year and 20 deaths. Shingles vaccines are available for people over the age of 50 or 60 because it is especially devastating at this age, particularly if there are any underlying conditions. There are 2 vaccines, Shingrix, a non-live recombinant vaccine, RZV, in the form of 2 shots between 2 to 6 months apart, and Zostavax, varicella-zoster vaccine live or LZV, which is a live vaccine. Zostavax was approved in Canada in 2008. Shingrix was approved in the United States and Canada in 2017. Shingrix is preferred over Zostavax, and is recommended that those able to and are in need of get Shingrix even if they've already gotten Zostavax. As of November 18, 2020, Zostavax is no longer in use in the US. Getting the vaccine is shown to reduce the chance of shingles by 50%. Though it commonly appears in people of an older age, it can appear in younger people and adolescents as well. Having other health conditions or weak immune systems could trigger the return of the virus. Having other diseases like HIV, AIDS, cancer, or going through treatment like chemotherapy or taking certain medications can increase your chance of shingles. Sometimes antiviral drugs can be given to lessen the severity, shorten the attacks, help sores heal faster, reduce new sores, and relieve pain and itching. This includes vasiclovir, aciclovir, and famciclovir. It can reduce by 50% the development of postherpetic neuralgia, which I will mention later. It is recommended to start the drugs at the warning signs of the developing rash, or when the rash first appears. If shingles appear near the eyes, it could cause permanent damage to the eye, and anti-inflammatory corticosteroids like prednisone are used. Shingles in the eye area have the highest risk of stroke at 5%. Antibacterial cream like fusidin acid cream can be prescribed to prevent bacterial infections in the lesions. It is good to keep the lesions clean and avoid going to public places, swimming pools, or interacting with people that haven't gotten the chickenpox vaccine or haven't had chickenpox. A cool damp cloth placed on the blisters may lessen the pain or help them heal faster, but it should not be placed over topical patches or creams such as fusidin. That said, scientists are still unsure as to why the virus returns and why only some people have it. As for the name chickenpox, there are multiple possibilities for the origin of this name. The bumps appearing like chicken pecks or the bumps looking like chickpeas. The most likely source is the thought of the mildness of this disease compared to smallpox, written by Samuel Johnson in his dictionary in 1755. Its scientific name, however, varicella zoster, comes from root sources. Varicella comes from the Latin variola, which means smallpox. They are two different viruses, though. Zoster is a Greek word meaning girdle, which is the shape which shingles form. The word shingles also comes from the Latin cingulum, which means girdle or belt. Don't let its name fool you, though. Chickenpox can be deadly and cause many complications. It is never recommended to purposely expose anyone, including children, to chickenpox with the thoughts of gaining immunity. Vaccines are recommended and safe. This also decreases their chances of getting shingles when they are older. One of chickenpox's complications includes encephalitis, a brain inflammation that causes the lining of the brain to be inflamed. It can cause headaches, confusion, fever, and vomiting. The way encephalitis is diagnosed is by checking your spinal fluid, similar to how meningitis is found, sticking a needle in a specific part of the spine to look for pus in the fluid, glucose, or protein that is cultured to look for viruses. Another is bacterial infections in places including the bloodstream called sepsis, and secondary bacterial infections that are common for complications of primary dermatosis. Complications can also cause pneumonia, called varicella pneumonitis. It can be a potentially fatal complication. Those with a weakened immune system can develop aggressive lung disease, but those with otherwise relatively healthy immune systems can lead to serious pulmonary compromise. Aciclovir can help decrease their chance of complications. Shingles can also be very dangerous. It is possible that a person that has gotten chickenpox will never get shingles, but some people do. There is no current cure for shingles, but the vaccines can help prevent it. Even if the person has gotten shingles once, they should get vaccinated because shingles can return again. There are also many complications. One of them is postherpetic neuralgia, abbreviated as PHN. Out of the 130,000 cases each year in Canada, 17,000 of them have had postherpetic neuralgia. With this, pain from the rash persists long after the rash is healed, and the pain can be mild or severe. 20% of people around 70 or more develop this long-lasting pain. This is caused by damaged nerve fibers that send exaggerated and confused messages to the brain. There are about a dozen medications that are successful in providing pain relief, but some have high side effects and not recommended to older populations. Tricyclic antidepressants or TCAs are often the first drugs given, but should not be given to those that have irregular heartbeats or experienced heart attacks. It has many side effects like dry mouth and eyes and impaired memory. An alternative like dizipramine or nortriptyline has fewer side effects, so it is a better choice for older adults. Topical and local anesthetics are applied to the skin of the area where there is pain. Because it stays in the skin, it does not cause side effects like drowsiness or constipation. Lidocaine is most often prescribed and comes in cream, gel, spray form, or patch that is used specifically for postherpetic neuralgia. Postherpetic itch is an itch that occurs during shingles or after. It can often be a painful and severe itch. It mostly appears on skin with severe sensory loss, so it is important not to scratch them. Topical local anesthetics can help numb the skin and provide relief, but postherpetic itch is regarded as harder to treat than postherpetic neuralgia. Other complications can include vision loss from infections and shingles near the eye, facial paralysis, hearing problems, having a hard time balancing, and serious cases that include encephalitis, meningitis, or stroke. Infections can also be present, such as skin infections or bacterial superinfections in the lesions, usually caused by Staphylococcus. In rare cases, shingles can spread all over the body. Disseminated shingles, as it is called, is more common in those with compromised immune systems and can look similar to chickenpox. It is also possible to get shingles pain without developing a rash. This is called Zoster-Sein-Herpet, or ZSH, and can be hard to diagnose because of the lack of blisters. They can develop complications like PHN, encephalitis, and stroke. Chickenpox can in some rare cases spread from the pregnant mother to the child. During the first 30 weeks, it is possible that it can cause congenital malformations in the child, but they are very rare. If the mother gets chickenpox 21 to 5 days before giving birth, there is a chance that she could pass it to the child, with the baby having chickenpox at birth or a few days after birth. However, during this time period between the two events, it is usually enough time for the mother to develop antibodies to fight the virus, which can be transmitted to the unborn child and fight the infection. There is a small percentage that the child whose mother was exposed to the virus 21 to 5 days before birth can develop shingles within the first 5 years of life because of their developing immune system unable to keep the virus latent. Pregnancy can also sometimes trigger shingles, but it usually poses no threat to the child. If the mother gets chickenpox at the time of birth, however, the newborn still has an immature immune system, which makes it hard for them to fight off the virus, which could make it fatal. Zoster immune globulin, which is antibody-rich blood from adults that have recently recovered from chickenpox or shingles, is administered to help them fight the virus or lessen the severity. Chickenpox may seem trivial and small, but it can result in dangerous complications. It is always important not to contact people with chickenpox on purpose and to stay safe. Thanks for learning with me.